From the talk that we have today, collectively getting the experts from all around the world who are the best at what they do when it comes to innovative treatment, saying in cellular therapy, being stem cells, being gene therapies, being bone marrow transplant methodology that reduces toxicity. We see that the trajectory of this is going in a very fast pace. We're anticipating in the next coming years that these kind of treatments will be more accessible, that will be having a shorter time of kind of, let's say, recovery, better kind of outcome in terms of cure, as an intention to cure methodology. When we look at our pediatric patients, we always kind of very adamant on the safety of the medicine or the cellular therapy that we're going to give them. And we need a holistic system. We need a team of expertise that will take care of the problem before the problem happens. The future findings, so iPSC technology started maybe, I'll take you back in time, 2008, when Manaka Group worked on the iPSC, which are stem cells that you reprogram to their originality, and then you can influence them to become anything. Let's say you take a skin cell, you take it back in time to stem cell, and then when it's stem cells, you can take it to any cells you want, being a heart cell, being a brain cell, being a kidney cell, being a pancreatic cell. So just speaking about the concept, imagine a world later on when people will no longer wait for an organ to be transplanted, saying, is it a heart organ, a lung organ, right? So this is what we are aiming for. This is where we see iPSCC. Then you speak about diabetes, how devastating it is, especially in young kids who are dependent on insulin. So you want the quality of life. We want to make sure that those iPSCCs will be helping us to generate a new pancreas for those in need. So looking at it from this perspective, we want to accelerate it. We want to make sure that in our lifetime we can see this and we can see the hope for those kind of babies. The challenges will always go around the regulation around it, right? And how, because of something so unique, how would we standardize it? How can we make sure that the line process of doing these stem cells are safe to administer? How can we also make sure that the effects that we want out of them and the outcome is there? So it needs a lot of efforts in terms of manpower. The expertise are not so much in the world, so bringing them together is creating what you call a boost in expertise. So bringing people together, this is one point. The second is partnership with people who have done that, been there, where they stopped, where we can continue. We don't need to reinvent the wheel. What we need to do is work together to make it happen. The third and the last thing I would say is investing in it. We would love to see a lot of people who will have the buy-in from a private and public perspective. How can they invest in it? How can they move it fast? I'll give you an example. Vaccines, when it happened, everyone invested in it and it grew so fast in COVID era. We would like to see the same enthusiasm when it comes to iPSCs.